Welcome and thank you for joining me. In this brief but practical module, we'll explore how occupational therapists can ethically and effectively integrate complementary health approaches like Reiki, mindfulness, guided imagery, and visualization into trauma informed and client centered care. You'll walk away with tools you can apply right away and documentation strategies to stay aligned with scope and standards. Learning objectives. Participants will be able to identify complementary health modalities appropriate to OT practice, be able to apply trauma informed care principles to the delivery of complementary health interventions within client centered OT treatment, and to be able to document complementary health based interventions using appropriate language in SOAP note format. When we Before we dive into the content, I invite you to take a moment for self-reflection. So, this is a brief optional activity designed to help you gauge where you are currently in your terms in terms of your confidence and your awareness around integrating complementary health approaches and integrative health into OT practice. Let's begin with the foundational knowledge. CHAIH stands for Complementary Health Approaches and Integrative Health. These are approaches that exist alongside conventional care and can be integrated into supporting holistic, client centered occupational therapy practice. So, in this section, we'll look at how CHAIR aligns with the OT domain, our professional documents, and current healthcare standards. In 2023, the AOTA released an official position statement supporting the ethical integration of complementary health modalities into OT practice. This includes practices like Reiki, mindfulness, guided imagery, aromatherapy, and more, as long as they're evidence informed and aligned with occupational therapy scope. This position statement reinforces that complementary health is not outside of OT. It can be integrated with clinical reasoning and documentation to support therapeutic goals. A quote from the position paper says that occupational therapy practitioners may incorporate complementary health approaches and integrative health when they support engagement in occupation and align with professional standards. So, why does complementary health matter in occupational therapy? Well, first, it supports our holistic philosophy. We're not just treating a body part or a diagnosis, we're supporting the whole person. So, modalities like mindfulness or guided imagery can help reduce anxiety, improve pain tolerance, and promote overall emotional regulation. And all of these enhance occupational performance. So, complementary health modalities can also support the nervous system regulation, which is foundational for participation in daily activities. OTs are uniquely positioned to integrate mind and body approaches into functional routines and to be able to document complementary health as therapeutic interventions as they link to the goals. It can also deliver trauma informed and client centered care, which is a foundation in a lot of complementary health modalities. The Occupational Therapy Framework, or the OTPF, also supports complementary health interventions. They support mental health, emotional regulation, pain management, sensory processing. These are all embedded in our scope. The OTPF4 emphasizes client centered, evidence informed approaches that support participation in meaningful life roles, and complementary health modalities fit within that role when used appropriately. As we end the first module, I'd like to leave you with an affirmation and a quote. Affirmation: I honor the whole person, body, mind, and spirit in every therapeutic encounter. And a quote by Rachel Naomi Remen says, healing may not be so much about getting better as about letting go of everything that isn't you. So, before we move on to the next section, please take a moment to complete this brief knowledge check. It's 5 multiple choice questions and it should take no more than 3 minutes. The questions are designed to help reinforce your understanding of complementary health foundations and the appropriate integration into OT practice. So when you're ready, pause, click the link, and then return here. In section 2, we'll cover 4 complementary health modalities that are commonly integrated into OT: mindfulness, guided imagery, visualization, and Reiki. We'll define each one, review its therapeutic intent, and explore how these modalities can support occupational performance in ways that are client-centered and trauma-informed. In this section, we'll explore 4 evidence-based practices commonly used in complementary health. Mindfulness, which is simply being fully present and aware without judgment. It helps clients develop attention and emotional regulation. Guided imagery. This is when we use mental imagery with therapeutic purpose, like imagining a safe place or a peaceful setting to promote calm. Visualization is a close cousin to guided imagery, but more intentional. It can focus on specific outcomes like success in a task or simply just calming the nervous system. And finally, Reiki, which is a biofield energy technique using light touch or near body touch to promote nervous system regulation and emotional balance. And all of these can support self regulation, emotional clarity, and client engagement in occupational therapy practice. This slide highlights key research supporting the use of complementary health modalities in OT, starting with Reiki. There's studies by McManus in 2017 and Baldwin in 2017 show that Reiki can reduce anxiety and pain while promoting a sense of well-being. Mindfulness has also been shown to improve attention and emotional regulation by Garland 2015. Um, it also provides strong evidence for its impact on cognitive and emotional function. And guided imagery, as Ahern in 2006 described, it plays a role in nervous system downregulation, helping clients transition out of a heightened stress state and into a place of calm. So all 3 have measurable benefits that complement occupational therapy goals. Mindfulness in OT practice is being present and aware without judgment. It helps the client build awareness of their thoughts, emotions, their body sensations in a grounded and non reactive way. So, in OT, we might use mindfulness to help clients reduce anxiety before task initiation, or to manage pain, or to improve emotional regulation during daily activities. This slide further explains how mindfulness can be integrated into OT sessions. So on the left, we see how mindfulness helps clients. It can improve focus and awareness, which supports engagement in therapy. Also helps manage anxiety and stress, which can otherwise interfere with occupational performance. And importantly, mindfulness has been shown to enhance cognitive flexibility, according to Garland and colleagues in 2015. They found that this is particularly relevant in populations facing cognitive or emotional challenges. On the right, we see some practical uses with OT. It can be embedded into ADL retraining to help clients stay present and reduce frustration. It's also highly effective and coping skill development during transitional support or mental health focused sessions. These applications align with OT's emphasis on emotional regulation, task participation, and functional outcomes. So, for example, you might use mindful hand washing for sensory integration or mindful walking with breath awareness. This slide explains the therapeutic use of guided imagery and visualization in OT. At the top, we see that guided imagery uses mental imagery to promote states of calm, healing, and concentration, also used with individuals experiencing stress, chronic pain, or emotional overwhelm. The second point highlights that this technique may include imagining a peaceful place or a symbolic journey or something like a healing light that comes in and offers support wherever they need it. Finally, this modality supports the parasympathetic nervous system, which helps to downregulate stress responses. It also promotes cognitive modulation, offering a bridge between the emotional brain and the thinking brain. And these strategies are easy to adapt across all populations and can be layered into functional OT sessions for self regulation and pain management. Guided imagery is a technique that uses mental visualization with therapeutic intent. Clients are guided through calming, meaningful, or empowering imagery, often involving nature, warmth, or safety to help reduce pain, anxiety, or emotional overwhelm. This modality taps into the mind body connection and supports nervous system regulation. In OT, it can be paired with self care, sensory modulation, or stress recovery. With visualization techniques, they're often used in sports psychology. Now it applies to neuro rehab, anxiety treatment, and OT coaching. So, visualization is similar to guided imagery, but often more goal directed. So it involves intentionally imagining a desired outcome, like successfully completing a task or feeling confident or staying calm in a stressful situation. It's commonly used by athletes and performers, and it also is useful in OT for supporting occupational readiness, self efficacy, and mental rehearsal for new roles and routines. So, let's talk briefly about how you might apply these modalities within a typical OT session. You can introduce a mindfulness, visualization, or guided imagery practice at three key points. You can do it before a task to help ground the client or reduce pre task anxiety. You can do it during the activity to support emotional regulation or to increase focused attention. You can also do it after a task as a way to consolidate learning, to help process emotions that may have come up during the session. But the key is to keep it short and optional. Just 1 to 3 minutes can make a meaningful impact without taking over your entire session time. And what is Reiki? Reiki is a biofield energy technique that involves either gentle touch or hovering hands over the body. So the word Reiki comes from Japan and is translated to universal life energy. It's a non invasive practice used to support balance and wellness across emotional, physical, and even spiritual dimensions. Though in occupational therapy, we always focus on the therapeutic application in alignment with our professional scope, many clients report feeling more calm, more grounded, or more emotionally clear, or just have more mental clarity after a Reiki session. So, how does Reiki work? So, Reiki is based on the concept that the human body has a natural energy field. So, practitioners act as a conduit, meaning they're not giving their own energy, but facilitating a flow of healing energy to support the body's innate regulation processes. Clients often describe experiences like deep relaxation, emotional release, gentle sensations, warmth. They can feel tingling. Some report feeling clearer, lighter, simply more grounded after a session. It's important to remember that results may vary, and we always approach this work through the lens of trauma informed care and client centered consent. This slide answers one of the most common questions. Can Reiki really be part of occupational therapy? And the answer is yes, when it's done thoughtfully and within our scope. So, Reiki sessions can reduce anxiety, can reduce pain and stress. These are all barriers that interfere with occupational performance. They also support introspection, emotional regulation, self regulation, all of which are relevant to functional goals. Reiki aligns with OT when it's clearly linked to function and documented using OT language and delivered within ethical, trauma informed, and client centered care. We don't just do Reiki for relaxation, we use it strategically to support participation in daily life. So, before we move on to the next section, please take a moment to do this brief knowledge check to solidify your learning. Now let's shift into trauma-informed integration. This section is all about safety, emotional, physical, and energetic safety. We use the complementary health modalities in occupational therapy. We need to ensure that we're not just doing what feels intuitive or effective, we're also practicing in a way that respects consent, boundaries, and nervous system regulation. And we'll talk about emotional safety, opt in participation, and the polyvagal informed care to ensure that these practices are always supportive and not triggering for our clients. So, according to AOTA in 2020, trauma informed care emphasizes safety, trust, collaboration, choice, empowerment, and cultural humility. This framework helps us to reduce the risk of re traumatization and make therapy feel safe and empowering for every client. It's especially important when incorporating spiritual or body based modalities where emotional vulnerability might be higher. So, keeping these principles in mind ensures that complementary health practices are ethically sound and client centered. Trauma-informed care is essential when integrating complementary health because these modalities they can bring up emotional responses, especially for clients with trauma histories. So, modalities like Reiki or guided imagery might not feel relaxing for one client, but triggering for another if they're not ready or don't feel safe. So, that's why we always ground our use of complementary health modalities in safety and client trust and attuned in ethical practice. So this approach is supported by AOTA and aligned with the polyvagal theory, which helps us understand the nervous system response. The ethical use of complementary health modalities means obtaining informed consent for introducing anything new. This includes being upfront about what the modality is and what it's not, and making sure the client feels in control. So, we want to avoid suggesting that complementary health practices will cure or heal. So, language like that can be very misleading and disempowering. Instead, we document in clinical language, such as visualization to support regulation, rather than referencing energy shifts or spiritual interpretations in medical records. When we incorporate complementary health and holistic practices in OT, it's essential that we do so with trauma informed care at the forefront. Many of the modalities we explore can be unintentionally intense. Emotions may rise, you may have crying, these things you have to prepare the client for. And this is why consent is not just a one-time check mark, it's an ongoing dialogue. The AOTA in 2020 identified trauma-informed care as a core component of practice, especially for the vulnerable population. So that includes creating a safe environment, inviting clients to guide their own comfort levels, and make sure every technique we offer is grounded in respect and readiness. Trauma informed care isn't just about protecting clients from re traumatization, it's about actively creating conditions for trust, for empowerment, and choice. As OTs, we already know the value of therapeutic use of self. That means we bring our whole presence into our sessions and build spaces where our clients feel safe and seen. And these four key principles, safety, choice, trust, and empowerment, guide our integration of complementary health modalities. We offer, not prescribe. We explain, we don't impose. And we always leave room for the client to say no thanks or to ask for more. This client led approach is what makes integrative healing in OT both ethical and effective. So, this slide outlines four practical trauma informed strategies that support safe and ethical integration of complementary health practices into OT. So, first, we always want to offer opt in choices for each component. Never assume someone is comfortable with touch, with silence, with visualization, or even stillness. Giving choice restores agency. Second, use neutral grounding language. This helps avoid triggering metaphors or spiritualized language that may not resonate with the client. So, for example, instead of sending light through the body, you might say inviting a sense of ease. And third, it's important to check in before, during, and after complementary health practices. A quick, how are you feeling in your body right now, goes a long way in preventing overwhelming or um, gauging intolerance. And finally, practitioners must use their own self regulation tools. Your own calm nervous system is one of the most important therapeutic tools. So if you feel dysregulated, it can impact your client's safety and the energy in the room. When working with trauma survivors, even well meaning practices like Reiki, guided imagery, or mindfulness can unintentionally trigger distress. So, this slide highlights four common trauma triggers to be mindful of. So, number one is the unexpected touch. So, even hands off Reiki can feel intrusive or threatening if not properly explained or consented to. So always describe what you're doing and give clients the chance to opt out. Closed eyes without warning may be unsettling or cause flashbacks for some clients. So instead, offer options like a soft gaze or focusing on an object or simply just lowering your eyes or just telling them you can open and close your eyes at any time. There are no rules. That's what I like to say to my clients a lot of times. Overwhelming silence or sudden shifts in energy like music or tone, that can startle the nervous system. So use gentle transitions, grounding cues, and verbal check ins to not shock the nervous system. And finally, imagery that mirrors trauma themes like darkness or drowning or isolation can reactivate trauma memory. So always pre screen the scripts if you're using some kind of guided imagery script to and encourage clients to co-create or guide their own imagery when possible. So, a quick reflection prompt. How will I create space of emotional safety, trust, and choice in my next client session, especially if I choose to use an integrative or complementary practice. And we'll end this section with an affirmation and a quote. I integrate with integrity, grounded in evidence and guided by ethics. In the quote by Lao Tzu, do not go outside yourself. Return to the root of your own being. You hold the answer.